Welcome to Review Central. This is Physical Therapist Licensure Exam Reviewer number 1. This reviewer is intended for those who are eyeing, or are set to take the Physical Therapist Licensure Exam given by the Board of Physical and Occupational Therapy, and administered by the Professional Regulation Commission of the Philippines. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous Physical Therapist Licensure exams. Let's begin. Question number 1. Patient is a 42-year-old male, 2-week status, post-ACL reconstruction surgery. Which of the following treatments is not appropriate at this stage in rehabilitation? A. Isokinetics. B. Straight leg raise. C. Quad sets. D. Isometrics. The correct answer is A. Isokinetics. ACL stands for anterior cruciate ligament, which is located in the knee. ACL reconstruction is a surgical tissue graft replacement of the ACL to restore its function after an injury. The torn ligament can either be removed from the knee, or preserved before reconstruction and arthroscopic procedure. Isokinetic training is a type of exercise training that uses a special machine. The exercise machine creates different levels of resistance. That way, the patient's movements are at a constant speed, no matter how much force he or she applies. Whatever the patient's strength level is, the machine can always match the amount of force being applied. Isokinetic training is not appropriate for early-stage post-ACL reconstruction surgery, up to 3 to 4 weeks, as it may include excessive weight-bearing exercises which may re-injure the ligament. On the other hand, the following are exercises that the doctor may recommend for ACL rehabilitation. Hamstring and calf stretches. Passive knee extension exercises. Half squats. Partial lunges. Heel raises. Elliptical training, and resistance training to improve strength. Question number 2. What is the minimum requirement for clear space, the open door face, and the door jamb, to enable a wheelchair to pass through the door? A. 500 mm. B. 730 mm. C. 810 mm. D. 1500 mm. The correct answer is C. 810 mm. By ADA standards, the clear width of a door opening must be a minimum of 32 inches, approximately 810 mm. This clear width measurement is taken between the face of the door and the stop of the frame, with the door open to 90 degrees. In pairs, at least one of the active leaves must comply with this clear width requirement. By the way, ADA stands for Americans with Disabilities Act. Question number 3. Chondromalacia patella is best treated through A. Quadricep exercises and extension. B. Bracing of the knee joint. C. Short arc quadriceps exercises. D. Quadricep exercises in flexion. The correct answer is A. Quadricep exercises in extension. Chondromalacia patella, that is, knee pain, is the softening and breakdown of the tissue or cartilage on the underside of the kneecap or patella. Pain results when the knee and the thigh bone or femur rub together. Dull, aching pain and/or a feeling of grinding when the knee is flexed may occur. The most common way to treat symptoms of chondromalacia patella is to rest the knee. A more proactive treatment or self-care for chondromalacia patella is to do exercises to both stretch and strengthen the quadriceps and hamstring muscles. Among the choices, quadricep exercises and extension are the most appropriate treatment. Question number 4. The frequency most suitable for microwave diathermy is A. 13.66 MHz. B. 300.12 MHz. C. 995 MHz. D. 2450 MHz. The correct answer is D. Microwave diathermy utilizes electromagnetic radio waves with frequencies of 915 and 2456 MHz. Based on the physical properties of these waves and the corresponding dimensions of the microwave antenna, microwave diathermy has 2 unique properties that can be used to clinical advantage. The first is that microwaves are selectively absorbed in tissues with high water content such as muscle. This makes microwave diathermy ideally suited to treat pathologic processes that occur in the muscles and adjacent fat. The second is that microwaves are more easily focused than the short waves used in shortwave diathermy, decreasing energy leaking and thus making heating more efficient and circumscribed. From the answered choices, the closest frequency is the one in option C, 2450 MHz. Question number 5. Traction is contraindicated in A. Acute herniated disc. B. Osteoporosis and acute herniated disc. C. Osteoporosis. D. Muscle spasms. The correct answer is C. Osteoporosis. Traction is contraindicated in osteoporosis, as can be seen in the list as shown. Traction is not contraindicated in autoherniated disc and muscle spasms. In fact, traction is a common non-surgical treatment for a herniated disc in the neck. It is a method incorporated into the physical therapy program to help avoid surgery in a patient who has been found to have a slipped disc on MRI and is suffering from neck pain with arm pain, numbness, tingling or weakness. Traction is also used to keep a group of muscles, such as the neck muscles, stretched to reduce muscle spasms. Question number 6. Which heat modality causes the greatest increase in tissue temperature? A. Moist hot packs. B. Ultrasound. C. Diathermy. D. Paraffin. The correct answer is C. Diathermy. Diathermy is electrically induced heat or the use of high-frequency electromagnetic currents as a form of physical therapy and in surgical procedures. Various laboratory experiments have shown that, compared to moist hot packs, ultrasound, and paraffin, diathermy causes the greatest increase in tissue temperature, up to 5.2 degrees Celsius as shown in the table of test results as shown. Question number 7. In crutch walking, the most appropriate strengthening exercise is A. Standing push-up on the wall. B. Seated push-up. C. Biceps curl. D. Push-up in prone. The correct answer is B. Among the answered choices, seated push-up is the most appropriate because it strengthens the whole upper body and arms as well as removes any form of pressure on the feet. Question number 8. To increase knee flexion range of motion, the proprioceptive neuromuscular facilitation technique of choice is hold relax applied directly to the A. Hamstrings. B. Anterior tibialis. C. Quadriceps. D. Iliopsoas. The correct answer is C. Quadriceps. The proprioceptive neuromuscular facilitation or PNF hold relax technique is applied directly to the quadriceps, as shown in the inset video. Question number 9. Which muscle weakness results to steppage gait? A. Hamstrings. B. Dorsiflexors. C. Plantar flexors. D. Hip flexors. The correct answer is B. Dorsiflexors. Steppage gait is the inability to lift the foot while walking due to the weakness of muscles that cause dorsiflexion of the ankle joint. The foot and ankle dorsiflexors include the tibialis anterior, the extensor hallucis longus, or EHL, and the extensor digitorum longus, or EDL. These muscles help the body clear the foot during swing phase and control plantar flexion of the foot on heel strike. Question number 10. The tissue that best absorbs microwave is A. Hair. B. Cartilage. C. Tissues with high water content. D. Bone. The correct answer is C. Tissues with high water content. Use of microwave for heat treatment works using the same principle behind microwave ovens in the kitchen. Microwaves are produced inside the oven by an electron tube called a magnetron. The microwaves are reflected within the metal interior of the oven where they are absorbed by food. Microwaves cause water molecules in the food to vibrate, producing heat that cooks the food in the process. The same principle applies to the use of microwave for heat treatment in physical therapy. That is why microwave works best on tissues with high water content, such as muscles. You have just completed Physical Therapist Licensure Exam Reviewer number 1. If you wish to watch more Physical Therapist Licensure Exam Reviewers, check out our Physical Therapist Reviewers playlist. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer, or other review materials on this channel. Please like if you find this video useful, and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming Physical Therapist Licensure exam, and we look forward to your fulfilling career and lifelong profession as a licensed physical therapist. Good luck and God bless.